And for today's lesson, we're going to talk about tumescent lidocaine distribution and utilization. Basically, how to use the allocated lidocaine amount. The maximum safe dose of lidocaine, remember, is 45 milligrams of lidocaine per kilogram. Okay, so you're gonna be given about 2,700 to maybe 4,000 milligrams of lidocaine per tumescent case. Okay, so of course the patient will always want as much fat taken out as possible. Okay, and of course you know that the point to liposuction is not to take out the maximum amount of fat, is to take out the amount of fat that would allow for a good cosmetic result, which usually means a natural looking post-op appearance. So I want to show you here, this here is a picture, can you see this, of deep fat, of the subcutaneous fat tissue layer. The pink is the deep fat, and then you have your mantle layer. Let's look at the yellow and the clear, kind of like washed out area of the pink, and then right under the skin you have your apical fat. So you're never going to try to take out apical fat. Okay, you can take out definitely deep fat, and the mantle layer you can use a finesse cannula if you buy your cannulas from HK Surgical, Dr. Klein's a surgical supplier. But when you're taking fat out from the inferior abdomen, and you have almost a pannus, or you can even have a pannus, that fat is pretty deep, and it's a common mistake to underestimate how much tumescent fluid it will take to adequately anesthetize that deep fat. You start with the deep layer, so I like to start by putting a wheel on the skin with regular lidocaine, just like a TB test, a wheel, and then introducing a spinal needle straight down perpendicular to the skin until you hit the fascia of the rectus abdominis muscle. And that's where I start infiltration on the pump, because the patient has not been anesthetized there. You start with a low pump rate or a pump power, depending on the machine that you have. Just note that the patient will feel burn if you infuse that fluid really quickly. So infuse it slowly, starting at the layer of the rectus abdominis fascia. And you don't have to move the spinal needle around. Just put it in there and let the infiltration begin. You're not supposed to see or feel skin changes because the lumen of the spinal needle is very deep. So you're not going to feel the skin changes, and you shouldn't feel them. If you feel or see skin changes immediately when you start to tumesce, you're too superficial, and that would not allow for aspiration of the deep fat without the patient being very uncomfortable. So if your patient is uncomfortable right when you start to aspirate at the deep layer, you did not give them enough tumescent lidocaine. So you start at the muscle layer, and you make sure that you infiltrate the entire muscle layer first, and then you bring your spinal needle, or you can use an infiltration cannula like a Monty, full Monty, tip Monty, whatever you want to use, to numb up the middle layer of the fat. Okay, numb up the middle layer. You start deep, then you numb up the middle layer, and then you make sure that the entire area that you're doing liposuction on has the deep fat adequately tumesced. That would take a lot of your fluid. Okay, this morning I have a case where I have a lady who her maximum dose of lidocaine is 3,200 milligrams, and it took about maybe 2,500 milligrams of lidocaine to numb up her deep fat. The rest of the fluid I will use to numb up the middle layer of the deep fat, and then the superficial layer. So the point here is that when you're seeing a patient in consult, they are going to want more areas than can be treated with tumescent lidocaine. You have to limit those areas to an area that you can adequately treat, and then bring them back at a second session. You can discuss price if you want, but bring them back where you can get those other areas that they want with the limit of lidocaine that they still have, but it's a separate session. So you can get a better cosmetic result and the patient is more comfortable. Once again, this is Dr. Baruti with the Liposuction Center.